Hello my dear students, so I welcome you to this class and I hope you remember that we are talking about the quality of the population in our country, and we said in order to improve the quality of the people, what we need is we need to have good education first of all. The people who are educated, their quality is increasing. They are a quality people. And if they are not educated, if they are illiterate, then they are not able to do anything. They will be just going on digging and digging in the farm, but they will not be able to do it creatively. They will be just using their ordinary methods. They will not be able to introduce anything new. They will not be able to accept any new ideas, and they will continue with their old style. They will not be able to think differently. But an educated person will be able to think differently, plan out differently, and able to bring better products. So that is one way of making the people qualified. And the second way of qualifying people is providing them good health. So after providing good education, you also need to provide good health. So a good person, a healthy person is an asset to the nation because he has got great health, he can do a lot of work, he can work long hours and so on. If a sick person is very sickly, then he will be able to work only few hours and then he will be very tired, he will be taking rest and so on. But a healthy person, he can work for long hours. That is a great asset. So people can work long hours if they are healthy. And if the people, we can compare people with good health and bad health, who will be able to work longer or whose work will be more effective, or whom will the employer like to appoint. If two people come for seeking employment, one person is looking very sickly, another person is very healthy, so naturally the officer will appoint the healthy person because he knows this person is able to work long hours. Another fellow will be sick all the time, will be going to hospital, buying medicine, taking leave, taking rest and so on. So such kind of things can happen. So if the person is healthy, then he will be able to fight the illness. He will not get sick very easily, very fast. But a person who has got very weak health, maybe because he is not taking any good food, maybe he is eating not the nutritious food, and so his health will be very weak and very often he will be getting sick. But a healthy person, he can fight against the sicknesses. His body will have the ability to fight against the sicknesses and he will be able to work for more hours because he is healthy, he will not get tired very fast. Then an unhealthy person is a liability. I said if a healthy person is an asset, then an unhealthy person is a liability, opposite of asset. So asset means something that is profitable, something that can improve our condition. So a healthy person will be an asset for an organization, asset for a nation. He will be able to work and bring a lot of rewards, lot of improvement in the company or in the factory and so on. But a sickly person is a liability, where he is supposed to come for work, he will not come. He will go to hospital and he will get tired very fast, he will be taking rest. So he will be a liability, will not be much use to the company, to the firm and so on. So health is an indispensable basis for realizing one's well-being. So if you want to say a person is well-being, that means he is in good form, good health, then we have to look at his health. If he is having a good health, then he is really in good shape. And therefore, improvement in the health status of a population has been the priority of our country. So the government realized, especially after the independence, the government realized that most of the people in India are unhealthy, and earlier we saw they were uneducated. the literacy rate was so low. And now the government realized they are also unhealthy. They are not able to work for long hours because they are very poor in health. So therefore government realized the importance of setting up health infrastructures to improve the people, to provide them medicine, to provide them nutritious food and so on. That's why government started PDS system, public distribution system, where a certain amount of nutritious food will be distributed to every poor families. Rice, pulses, oil, sugar and so on. So all the necessary things were supplied to the poor families at a low cost, very low cost, cheap price. They were distributed, and so that the people can have some nutritious food in their life and improve their health. Then so government, in order to improve the healthcare, government has to make the hospitals, it should appoint the doctors there, nurses there and provide medicines and so on. So we have in our country so many government hospitals are there, but most of them are not functioning properly. Either the doctors are working somewhere else and they come to hospital only sometimes whenever they are free. They are worried about making more profit. Or the medicine that is coming to the hospital for distribution, they sell it away to somebody else. And so when the patients come and ask for medicine, they will say there is no medicine. So that way, lot of corruptions are there in our health system and our health department. Therefore, government has to take strict action in order to clear all these corruption elements and bring a lot of benefits to the people in order to improve their health and so on. Then government also is giving a lot of attention to the people who are underprivileged. So people who are underprivileged, people who are less privileged, people who are poor, people who belong to low caste and so on. So it is very often they are the ones suffering because of their social status, because of their economic status, they are suffering. And therefore government is concentrating in order to help these people, to help them to come up in their life by providing we can say concessions, they are providing financial assistance and so on. Government is trying to help them out. Then over the last 5 decades, we can say over the last 5 decades, that means last 50 years, one decade is 10 years. So last 50 decades, 5 decades, that is 50 years, we can say a vast health infrastructure has been built up. So comparing to the last 5 decades, we can say a lot of health infrastructures. That means a lot of hospitals are built, a lot of dispensaries are built and so on. So government has done a lot and has developed manpower required at primary, secondary and tertiary sector in government as well as in the private sector. So government has developed a lot of people who need to work in the primary level, secondary level and tertiary level. So that means government provide them education, government provide them training. That's why and they are able to get the people who are working at different levels. So without proper training, without proper education, we cannot appoint anybody in the health sector. It is dangerous for others' health. So doctors should be trained properly and nurses should be trained properly and the other health workers, everyone should be trained properly. They should know what is their work, how they should do, what they should do and so on. Therefore, government has done all these things in order to help the people, in order to help them to improve their health and other things in their society. And so we can say these measures are adopted, increase the life expectancy to over 66 years. So olden times or soon after the independence, the life expectancy of the people, it was very low. The people were not average, life expectancy of the people were very low. But by the years 2011, it has come up to 66 years. So in 2011, 11, it has become 66 years. The average life expectancy, that means the average years that a person will live is 66. Some may live little more, some may live little less. But when we take the average, it is 66 years. Why? It has improved. Before it was much lower. Now it has come up to 66 because of the health facilities. People are able to get medicine when they get sick. People are able to get better treatment when they are sick. So because of that, people are able to live longer time. So average 66 years they are able to live. Then another thing that has improved in our country is infant mortality. So infant mortality means children who die within the first year of their birth. They are not even able to complete 1 year on this earth. Before that they die away because of their sickness, maybe because of malnutrition, maybe. So due to various reasons the children die away. Quite many children were dying. But now that also has come down. It has come down from 147. So soon after independence, 147 children were dying every year per thousand. So out of 1000 children born, 147 children are dying. They are not even able to live for 1 year. So now it has come down to 40. So in the year 2013, only how many children die? 40 children die in a year before reaching 1 year. So before it was very high, 147 children were dying. Now the rate has come down to 60. That also shows the improvement of health facilities. The children are given proper nutritious food. They are given proper medical care, checkup and so on. Therefore, they are not dying. They are able to survive, able to live for long years. Then the birth rate have dropped to 22.1 and death rates to 7 within the same duration of time. Now the birth rates have dropped to 22.1. So that is number of 1000 people, that is a death rate. So out of 1000 people, how many die? That is called death rate. So it has come down to 7 and the birth rate is dropped to 22.1. So government was able to help the people to control the birth of the children. So before the birth rate was very high. Now government has helped the people by using this health system or health infrastructures and other facilities to reduce the birth rate and also reduce the death rate. So people are able to live long time. Then increase the life expectancy and improvement in child care are useful in assessing the future progress of the country. So life expectancy should be increased. At present it is 66. So till 66 only average Indian are living, but they can go up to 75, 80 and so on. So if a person can live up to 80 years, then he can do many more works for many more years. No? Another 12 or 14 years more he can work. So if they die at 66, then it is a loss for the nation. The government is taking care so much for a person, providing education, providing health facilities, all that. Then suddenly he is dying at 66. Then it is a loss for the nation. So if he can go to work 80 or even 85, if a healthy person, if the person is healthy, then he should be able to work 80, 85 and so on. Then that much people can work more time for the country, more years for the country, and that will help them to develop. And also there should be improvement in child care. So if a person has to be healthy to live up to 80 years, then he should be taken care when he is a child. So from the childhood onwards, proper nutritious food should be given, proper medical care should be given. So then only he will grow up as a healthy person. Otherwise, After becoming big, if you give good food and medicine, his growth may be already stranded, already stopped, then cannot revive again. So we have to make sure that when they are child, they are given proper food and medicine, so that he will be healthy and will be able to live longer and work longer and so on. Then increasing longevity, that means living for many years, as an indicator of good quality of life marked by self-confidence. So a person who has got good quality of life, that means good health, he will be able to live for many years, long years. And also other thing that is required is self-confidence. The person should have a self-confidence that I am okay, I am able to do more work for the country and so on. So if a person thinks that I am a useless fellow, I cannot do anything, what is the use of living? Every day if he is thinking that kind of negative points, negative aspects, then he will not live for long, he will die early. But a person with self-confidence, he will be able to go on living for many years because he has got good health and he is fully convinced that he is able to do work for many more years. So that is the type of quality, that is the type of people we need in our country who can live long years with great confidence and work for the country and produce good results. Then reduction in infant mortality involves protection of child from infection. So we say the child mortality rate has come down. It has come down to 40. Before it was 147. Now it has come down to 40. So how is it possible? It is by giving medicine to the child. When they are children, we need to give proper care, proper medicine. Then they will be able to get good food, they will be able to get good health and able to live longer. So good health, for good health they need good food and good medicine, and that way the children will not die, they will continue to live. So that is an indication. So if child has to be in good health, what do we need to do? We have to make sure that mother is eating good food, because the child is getting milk from the mother, and if the mother is not healthy, child will not get the milk. Therefore, to take care of the mother, that is also important. It should not say mother is already weak, let the mother be there, let us take care of the children. So, when we say taking care of the children, it also includes the mother, the health of the mother. That is also very important. Without mother good health, the child may not have good health at all. So these are the few things that we need to keep in mind when we deal with the health. So we need to have good food, nutritious food, and we need to have proper medical care, and so that people will have long life, healthy life, and they will be able to live a long time. Then we can see the performance of the government. I hope you can see, or you can look in your own notebook. You see how it is improving. So the PHCs and the community health care and so on. So it is written in 1951 how many were there, 1981 how many, 2001 how many, 2010 and 2013. So we can see as the year by year it is going up, the number of institutions are going up, number of hospitals are increasing. So below that you will find number of dispensaries and hospitals. Then we will find beds, how many beds are there in the hospitals. Then we will find how many doctors are appointed there. Then how many nurses are there. So we see it is improving, year by year it is improving. That shows the work of the government is to help the people to improve their health by providing them hospitals, by providing them doctors, nurses, and providing bed in the hospital and so on. So these days we can see most of the hospitals, they do not have enough beds to accommodate the patients affected by COVID-19. Most of them are sleeping in the veranda, on the floor, and so all the beds are full. So government need to pre-plan that facilities are required. After getting the sickness, there is no time to go for searching for bed and so on. So government should have proper planning in order to improve the health care of people. They should be ready to serve the people in case of any emergency. So that is all. It includes the planning of the government. If the government has no planning, they will say, oh, let us take rest, nobody will get sick. Suddenly some kind of sickness will come, and then everybody will be suffering, and all will blame the government. So government has to do the planning in advance and provide the best for the students, for the people, children, and so on. Now let us see what can we do more. For example, they are giving you an activity, go and visit a hospital. And what is the percentage? There is also a chart is given there. In this chart what we saw just now, you can see what is the percentage increase in dispensaries from 1951 to 2011. See, in 1951 how many dispensaries were there, and in 2011 how many dispensaries were there. So we can see there is a great change. In 1951 there were only 725 dispensaries in our country. So that is community health center. Our dispensaries were 9,209, and after 50 or 60 years it will increase to 28,000 plus. So there is a lot of differences there. Then what is the percentage increase in doctors and nursing personnel from 1951 to 2011? You can see the number of doctors also increased. The doctors were 61,800, and it went up to 8,16,629. So you can see such a great improvement is there. On nursing personnel also same. The beginning there were only 18,054 nurses, but in 2010 it became 17,02,555. See what a great increase. So that all shows that the health condition of our country is improving. Then, do you think the increase in the number of doctors and nurses is adequate for India? If not, why? So we see there is a lot of increase in the number of hospitals, number of doctors, number of nurses are there. Do you think that is enough for India? You can see in the rural area still doctors and nurses are less lacking. We need more. So because the population in India is very high, and the health conditions of the people are not that good, therefore we need more doctors, more nurses, more hospitals, and so on. So what other facilities would you like to provide in a hospital? So if you go and visit in a hospital, what are the facilities you expect? The cleanliness, yes, maybe must be there. Then the facilities like good beds, good clothes, all that should be there. Then discuss about a hospital you have visited. I hope all of you might have gone to some hospitals at different times. Maybe when you are sick, or when you went for visiting a sick person, and so on. So you must be knowing what is the situation or condition of that hospital. Then can you draw a graph using this table? So can you draw a graph using this table? So try to draw a map and draw a graph in your notebook showing these figures. The Cbse, Cbse, how their map is going up and down. Then about dispensaries and hospitals, about beds, about doctors, about nursing personnel, and so on. So using this data, draw a diagram in your notebook and take photo of that and send it to my number. I will see. Okay. Don't forget, that is your homework. So try to do it. Then there are many places in India which do not have even these basic facilities. There are only 381 medical colleges in the country and 301 dental colleges. So we see the country does not have enough facilities for training. Medical colleges are there, very few are there. Only 381 medical colleges are there in our country. So medical colleges are functioning as a hospital. At the same time, they are also giving training for the new doctors, new junior doctors. So we have very few medical colleges are there. Then dental colleges. Dental means treating the teeth. The dental doctors. So to train the dental doctors, we have only 301 medical colleges. And just 4 states like Andhra Pradesh, Karnataka, Maharashtra and Tamil Nadu. These are the 4 states having maximum number of colleges. So these 4 states, Maharashtra, Karnataka, Tamil Nadu and Andhra Pradesh, they are very much ahead in the health department. They have provided a lot of health facilities to the people by starting a lot of hospitals and so on. But other states are still lagging behind. They don't have enough hospitals. When they get sick, they have to go to the other states. So each state should try to set up hospital in their own area so that the poor people will be able to go to hospital, take medicine and improve their health situation and so on. So these are the means or things that people should do. So the government should try to set up more hospital infrastructures, hospital to train doctors like medical colleges we need, and also to set up more hospitals infrastructures and provide more facility to the hospital, and so that way people can improve their health and they will be able to live long and they will be able to work long. That way people will turn out to be an asset to the country. They will be able to work and bring more income to the country, and the economic condition of our country will improve. That is what government can do in order to improve the situation, life situation of the people. So we shall wind up today with this point, and in the next class we shall study about the another problem that we are facing, that is the unemployment. Many people are educated but they are not employed. So let us study in the next class about unemployment. So thank you for watching. Have a nice day.